Majority of the locals in Dhobley, that's in Somalia, cannot access proper public health care and timely emergency medical attention as the immediate environment remains quite tense amid an existing Shabaab threat. KDF under AMISOM has however moved in to offer medical assistance to locals beside opening up main supply routes ahead of the planned 2021 exit. Elfas Lagat has more.
AMISOM Level 2 Hospital in Dhobley, Somalia represents a beacon of hope in a place where public health is started to the core in the last 3 decades. Injured military officers and locals find this facility immeasurably important. Dr. Solomon Murithi is KDF's neurosurgeon and thoroughly trained in combat, and is here attending to a Jubaland State Force soldier who was injured in an IED explosion just 3 months ago.
Is a soldier working with JSF, with Jubaland State Force, who has sustained an attack, Shabaab attack, while on duty. So he sustained a serious injuries on the right lower limb.
34-year-old Abdi, who counts himself lucky, makes careful steps with a noticeable limp, but his desire for a peaceful Somalia is even more pronounced by determination to heal quick and help in degrading the outlawed Shabaab.
So we see a wide spectrum of patients in this hospital. So approximately we treat 150 to 170 patients every month.
In the women's wing, mother and child have been admitted and attended to within the facility. They are among dozens of other locals who KDF have helped in providing medical assistance, just as is the case here in Dhobley Civilian Hospital, where KDF under AMISOM provide constant medical supplies.
We've been coordinating with them in terms of patient care, health care, and also to help them in capacity building.
Besides establishing a footprint in healthcare, KDF is now supervising engineering works and opening up main supply routes amid the threat of improvised explosives that continue posing a serious headache to the military personnel here. This main supply road, starting from Dhobley through Tabda to Afmado, is expected to be complete in 18 months, extending close to 200 kilometers, one of the main standout projects in the reconstruction of Somalia.
It is key and it is strategic in that it will help the Somali authorities to establish themselves as we go towards the drawdown or the withdrawal of AMISOM in December 2021.
It is no doubt a winding, bumpy path for Somalia, currently grappling with security issues as struggling healthcare and lack of proper political formation. The nation has been unable to stand on our own for more than 3 decades, but now AMISOM, the United Nations, and indeed the world is rooting for a new dawn in Somalia as December 2021 AMISOM troops exit edges closer. Elfas Lagat, Citizen TV, Somalia.